Okay, welcome all. I know this is closed to the public, not that we usually get throngs showing up for council meetings. This being a special meeting of council in a very interesting time for all of us. It may be piquing more interest than some of our other items that we generally have on council meeting agendas. So with that having been said, I will call this special meeting of council to order. Just to introduce more or less what's going on, before I get any further into the agenda, we'll be having two meetings. The first one should be relatively short. With the blessing of council, we'll be asking council to amend a bylaw, a procedure bylaw that will allow members of council to take part in meetings electronically. And by that I mean whether FaceTime, Skype, however we happen to beam them in from where they're living. Our CAO is working from home and will join us the same way, and two members of council are also working from home and will join us that way, pending the approval of the amendment to the procedure bylaw that we're about to address. So, would somebody be so kind as to make a motion to approve the agenda before us? Moved by Councillor Ainsworth, seconded by Councillor Campbell. All in favor? Carried. Thank you. You may notice at home that there are spaces between everybody here, and that is by design. Hopefully a demonstration that the staff and members of council take social distancing very seriously. That is one of the main ways to mitigate the effects of the virus. So we've got spaces here, and we've got Councillor Stapola sitting over where traditionally our CAO sits. Anyway, so the purpose of the meeting is to present two proposed amendments to council's procedure bylaws. Are there any disclosures of interest on this, based on this agenda? I imagine. I will say that I was on a conference call yesterday with the Minister of Health, with the Minister of Municipal Affairs and Housing, Steve Clark, and with the Provincial Medical Officer of Health. And one of the indications we got from the Minister of Municipal Affairs and Housing is that they will be, they were anticipating passing provincial legislation to enable municipal councils to participate, members of those councils to participate electronically, and they expect that to be passed by the end of the week. But it's not passed yet, so that's why we have to dive into this at the moment. So perhaps the Clerk's Department would be so kind as to introduce the first item.
Thank you, Mayor Clark. The report before you proposes two amendments to Council's procedure bylaws. The first amendment is to add provisions to enable members of Council to participate electronically in meetings due to an emergency and/or an unforeseen event, such as the COVID situation that is currently unfolding. At this time, a physical quorum of members is still required, and members of Council cannot participate electronically in a closed session meeting. Those are the parameters set out in the provincial legislation at this time. The second amendment is to add an emergency meeting provision that would enable Council to hold a special meeting of Council with less than 24 hours public notice. And as Council is aware, staff do bring forward amendments to procedure bylaws from time to time, and this particular area was identified as an item that should be brought forward for your consideration, as many municipalities do include these emergency provisions within their bylaws. And given the events as of late, staff deemed it prudent to bring forward this amendment sooner rather than later. Both amendments are set out in detail in the report, and I'm pleased to answer any questions members may have.
Thank you very much. Thank you very much, Madam Deputy Clerk. There is a motion on the screen before us. Is there a mover and a seconder for that? Thank you, Councillor Ainsworth. Thank you, Councillor Iman. That as recommended in report CD 2003 dated March 17th, 2020 from the Clerk's Department, chapters, thank you very much, chapters 12 and 22 of the City of Orillia Municipal Code, Council Committee and Council Procedure be amended to include a provision to enable members of Council to participate in meetings electronically as set out in the report, and that Chapter 22 of the City of Orillia Municipal Code council procedure be amended to include that provision enabling the calling of an emergency special meeting of council with less than 24 hours notice as set out in the report. I will look for discussion on this motion. Councillor.
Thank you, Mayor Clark. Just one point of clarification from your opening remarks. The legislation currently allows members of council to participate electronically, but not to vote and not to count as part of quorum. And we're now having to change our legislation to align with that. What you were talking about, the minister is going to change, I believe, will allow us to all come together electronically and have quorum electronically, and to be able to actually vote on things. But that's why we're gathered today, is because the legislation still requires us to meet and have quorum present in a room, if I'm not mistaken.
Indeed, I will look for comment from our deputy clerk, but that is exactly how I understand the situation. Madam Deputy Clerk.
Through you, Mayor Clark, yes, you're quite correct, Councillor Emond, in that as of this time, a physical quorum is still required. And so in terms of the ability of a member of council who's participating electronically, they are allowed to vote, is our understanding, and they are permitted to vote. But certainly at this time, we require a physical quorum of 5 for this council. And so 5 must be present, but those who will be able to participate electronically can still vote.
And Mayor Clark, this exercise, changing our bylaw, is to take advantage of what the province allows councils to do, but does indicate that the councils must change their procedural bylaw to take advantage of that, as I understand it, and that's what we're doing right now. So,
if I can, Mayor Clark, yes, that's absolutely correct. This was put forward, and the province enabled councils to do this in 2017. And so that is well within council's right now to do that. It just does need to be enshrined in your bylaw. And we've indicated some parameters within the report that does add some flexibility as well if the province does go forward with any amendments relaxing the physical quorum rule that we do anticipate could come by the end of the week. So we're quite confident that the wording in the report will enable council to take advantage of any provincial legislation coming down in the next week or so and not be in contravention of your bylaw.
Thank you. Councillor Ainsworth.
Yes, through you, Mayor Clark. Originally, I was not in support of moving towards electric participation. Then when I dove further into the report, seeing that it's just for emergencies, I think that is something that is quite all right, especially, today, given the circumstances of, trying to separate people from each other, that sort of thing. I think it's quite apparent that we do need to move in this direction, and I like that within the bylaws and such, it does set out that it is for emergency use only, not just for regular meetings, which kind of gets away from my previous worry, which is, just for regular meetings that will have electronic participation. That will not be the case.
Indeed, I would suggest the chair of this meeting would share those same concerns. So thank you for that. Good point. Councillor Spola.
Thank you, Mr. Mayor. My understanding is that if we exist on the will of the province, so if they change the rules to allow us to meet electronically and everything else, then will this bylaw be obsolete? So because we only exist on the will of the province, so I'm not sure. I mean, I don't disagree with it today because the province hasn't come across yet. But once they do, then this bylaw that we're putting into place or amending it will be obsolete. That's my understanding.
Well, we certainly have not seen the legislation that they're talking about putting forward, but so that will be germane to part of your question. But I will ask Ms. Williams to weigh in.
Yes, thank you, Mayor Clark. Again, you're quite correct that we don't have that wording yet, and we don't know sort of the time frame that will be attached, whether it will be indefinitely or within a prescribed time frame. And certainly we have added, and you'll note this within the report, wording that enables flexibility for council to take advantage of anything that does come down from the province. So we've indicated that certainly the rules as stated in the Act do apply to council unless otherwise provided by legislation or a government act. And we do feel and are quite confident that council won't be in contravention of their bylaw depending on what comes down from the province.
Thank you both. Any further questions, comments? Sorry, Councillor Lauer.
Thank you, Mayor Clark. Just curious, how do we define an emergency meeting? Is it any meeting that's unscheduled, or I'm just wondering who and how we define an emergency meeting?
Ms. Williams?
Thank you, Mayor Clark. So you'll note within the report that we say as determined by the head of council. And so we've worded it as an emergency or urgent unforeseen event as determined by the head of council. And that we believe, rather than being specific, will enable council to have the flexibility for any ongoing issues such as the COVID situation that we're seeing right now, and any other unforeseen event that we can't know and don't know at this time.
Okay, but I guess where I'm going is this is an obvious emergency situation. We have a health issue. It's huge. But by that definition, the head of council could decide that a development issue was an emergency and could call a meeting, and these rules would fall into play. It doesn't have to be necessarily health and safety, or does?
Through you, Mayor Clark, I believe that would be more an emergency special meeting, which again is the second amendment that we're bringing forward here. So you'll note within the report that we're adding an emergency special meeting provision as determined by the head of council, chief administrative officer, and the clerk to deal with a matter deemed to require immediate action. So I would submit that more than likely, something as a development or something that is time sensitive, the head of council would give due consideration to whether it does constitute an emergency, and if so, would invoke this separate provision for your consideration.
Councillor Spolin.
Thank you, Mr. Mayor. Just maybe some clarification. My understanding that 5 members of council can ask for a meeting without anybody authorizing anything. It doesn't have to be an emergency, it doesn't have to be anything, but 5 members of council can ask for a meeting, and it has to happen if that's the will of the 5 councillors.
That's my understanding as well, but I'll let Ms. Williams weigh in. But that there are special meetings of council, not just emergency meetings of council, that can be called in short order with 5 members of council. But Ms. Williams?
Through you, Mayor Clark, Councillor Sapola is correct. Within your procedure bylaw, members of council can petition the mayor to hold a special meeting. However, it is subject to your public notice requirements that are currently in your bylaw, which states that 24 hours notice must be provided.
Okay, good discussion. Unless there is further discussion, I will now call the question. All in favor? That is carried. Thank you. Now, as I understand it, we'll wait for a corresponding bylaw for council's consideration.
No, I voted for it. I'm trying to get away from him coughing.
Oh. Well, I really have.
Maybe.
Nothing going on, really. I think it's my allergy to not being at the gym for a number of days.
Yeah, you're left-headed, or something.
Here, there's so this is the proposed bylaws to enable us to enact what we just passed, the resolution. Is there a mover and a seconder? Councillor Campbell and Councillor Ainsworth, thank you. That the following bylaws be enacted. 2020-17, a bylaw to amend chapters 12 and 22 of the City of Orillia Municipal Code Council Committee and Council Procedure. Thank you. This bylaw amends Chapter 12 and 20 to include a provision to enable members of council to participate in meetings electronically as authorized by council. 2020-18, a bylaw to amend Chapter 22 of the City of Orillia Municipal Code Council Procedure. This bylaw amends Chapter 22 to include a provision enabling the calling of an emergency special meeting of council with less than 24 hours notice as authorized by council. Is there any further discussion? I will call the question. All in favor? Carried. Thank you. And to the gentleman about 6 years ago who asked me to give the result of each of the votes, I am still doing that because of his advice or question. Okay. With that being done, I will now ask for a motion. I will ask for Madam Deputy Clerk to weigh in for a moment.
Through you, Mayor.
Sorry, bylaw to confirm proceedings.
Correct.
Thank you. As with any, at the end of any council meeting, we need to confirm with the bylaw the things that took place, and we'll do that with this motion. If there's a mover and a seconder to get on the floor, Councillor Campbell, Councillor Yvonne, thank you. That bylaw 2020-19, a bylaw to confirm the proceedings of council at its special meeting held on this very day, March 18th, 2020, be enacted. Thank you, Ms. Williams. Any further discussion? All in favor? Carried. Thank you. With that, I will now call for a motion to adjourn. Councillor Ainsworth, seconded by Councillor Emond. All in favor? Carried. Thank you. I will now probably ask for suggest that we reconvene in about 5 minutes and allow IT.
Through you, Mr. Mayor,
longer?
if we can have perhaps until 4:30, because we need to bring the offline counselors into the webinar that we've scheduled.
Yep, that's
Thank
fine.
you.
So we'll reconvene at 4:30 with council's blessing. And if you need a few more minutes to work out the bugs, that's fine. This is the first that we have time we've done this. So if anybody is joining us from home, then I would ask for your patience. Thank you. We just passed an amendment to our procedure bylaw, so we appreciate your patience. This is going to allow members of council who can't be here in extraordinary times to participate electronically. We have Councillor Klustra, Councillor Heen, and Councillor Follis, who are participating from home, as well as our CAO, Ms. Jackson. So we're just ironing out the bugs in our very first attempt at using this system. So I apologize for the delay, and we will get going as soon as we can. Thanks for your patience. So the minute Councillor Heen calls in because the other aspect wasn't working, then we'll proceed. All right, so I'm just going to use first names today unless there's somebody has a problem with that. Jay, can you hear me okay?
Yeah, I can hear you.
Well, I can assure you I can hear you. Rob, can you hear me?
Yeah.
And Gail?
Yeah, I can hear you fine.
Thank you. And Gail?
And I'm in.
Great, thank you. I'm just waiting for...
Hey, Pat's in. We got her in now.
Pat? Pat, can you hear me?
I'm in.
Okay. So it sounds like we're good to go. Thank you very much.
I can hear you.
And as much as we had some bugs to work out there, again, I'll thank everybody for their patience, including those on the platform today. Liz and Marcia and Kurt and...
Yes, I can.
Okay, gentlemen, members that are not here, if you can mute yourself until you have something to say, that will make things easier at this end. So Pat and Jay and Rob and Gail, can you just mute yourself?
How do I mute myself?
There's probably on your phone. Can push the mute button.
That's a very good idea.
Let's go back to the first meeting and rescind.
Yeah, can we accept?
Let's just rescind.
Okay, and if you don't have the ability to mute, or you haven't figured that out, please just try to keep it very, very quiet at your end because it's you're quite audible at this end. Somebody's got a TV or radio on in the background.
This sounds like those old call-in shows. Remember that? You used to phone in.
All right, I think we're good now. Anyway, despite the bugs that we've had to work out, I want to give a big shout out to our IT, Marcia and Kurt and Liz and Nathan. Not only have they been working on this, which we just kind of sprung on them recently, but preparing for other events and ways of doing work. And whether people have to work with a satellite system or work remotely. So they've been very, very busy scurrying around to do that. So I just want to say thank you very much to those folks. It is an extraordinary time. It may very well be the most interesting time that of anybody that's alive today, going up to this point and maybe even going forward. Some have suggested because of the global implications with this virus, with oil wars going on, with climate change, that it may be the most interesting time with the largest effect since World War II. I will say that this area is still low risk. There has been, today there was one case in Midland and there was one positive case in Orillia, and the person is now self-isolating at home. But having said that, it's still a low risk. But this thing, make no mistake, is real. It is spreading. But even having said that, there is no reason or no cause for alarm. There is cause for concern. And I think the challenge all of us have is taking that concern and turning it into action that actually makes the situation better. And there's just 4 or 5 things that we can all do that actually has the ability to mitigate the effect of the virus and stop the spike, maybe flatten out the curve and take the stress off of our healthcare systems. And those things are making sure that we observe 6 feet of social distance. That's strange, that's weird. I'm somebody who shakes dozens of hands a day and believes that hugs make the world a better place. But we have to break those habits, and we have to keep 6 feet between us. And apparently that is just about the strongest thing we can do to help mitigate the effects of the virus. Certainly washing your hands, 20 seconds warm soapy water or hand sanitizer with at least 70% isopropyl alcohol, as I understand. And if you're washing your hands, do so like you've just peeled a jalapeno and you're changing your contact lens. I think Christine Preston does that on a regular basis. If you have to sneeze or cough, do so into your sleeve, certainly away from anybody. And if you're sick, please stay home. And also, I would like to add, do not panic buy. Do not panic hoard. My understanding is from conversations that the supply chain is alive and well, and even if the borders do close, they will stay open for essential supplies. And my understanding from the retail, from conversations about the retail businesses, is they are not having a supply issue. Matter of fact, so don't panic hoard, don't panic buy. We need to make sure there are supplies there for everybody when they go for some. And I would even ask you to identify those, maybe even that are more vulnerable than you are, and reach out to them safely and offer to do what you can for them. I know somebody close to me that has posted notices on the doors of senior citizens in the area in which he lives, and has offered to go and pick stuff up for them so that they don't have to leave a residence. That's just one example of something you can do. So with having said all that, I will call this special council meeting regarding the coronavirus, or the commonly known as the COVID-19 update, to order. If somebody would be so kind as to make a motion to approve the agenda. Moved by Mason, seconded by Dave. Thank you. All in favor? Carried. Thank you. The purpose of the meeting is to provide an update with respect to the novel coronavirus, or COVID-19. Are there any disclosures of interest? Seeing none? At this point, I'm going to introduce our fire chief. He and our CAO and myself and some others have been spending a lot of time with this. The chief in particular, he is the head of our emergency control group within the city. It's a control group made up of about 30 people from different departments within the city and the OPP and Soldiers Memorial Hospital. That can be mobilized or enacted if an emergency warrants. We're not necessarily to that point at the moment, but that with things changing the way they are daily and even hourly, that is subject to change. But I do want to thank the chief for his tireless activity the last better part of 3 weeks, quite frankly, in preparing for what is coming. And turn this over to him for a brief overview of where we've been and where we're going. Sorry, before I go there, is that me coming through? No. Okay. Jay and Rob and Pat and Gail, can you guys all hear me? That is me. Okay, somebody needs to turn their volume down, because everything that I'm saying or that will be said around this platform is going to come back through the speaker system. So I will try again. I'll do a little test. Well done. Thank you. Okay. Nope. Somebody needs somebody still needs to turn their volume down. Okay. Okay, I'm going to go one by one. Rob, is your volume down as low as it can be and still have you hear it?
Yeah, it's all turned down.
Thank you. Jay, may I ask the same question of you? Thank you. And Pat, is your volume turned down to the appropriate level?
Yep, I turned it down now.
Yes, it's much better. Thank you. Well, at least it's not your phone going off in the middle of a council meeting. So you just, yes, indeed. Thank you. Okay, so with that being said, thank you for your cooperation in this new format in which we find ourselves. And Chief, if you would be so kind as to...
Is that better?
Yeah, that's very good. I really appreciate it, guys. All right. All right, Chief Brent Thomas, floor is yours.
Thank you, Mr. Mayor. Through you to the members of council present and online and those listening, thank you. I would just like to start by saying and echoing what Mayor Clark said in his opening comments, that these are very different times that we have never been in. Having said that, even as far as preparing a brief for council, you have nothing from me. Unfortunately, I just have physically not had the time to be able to write a brief for you, and that's separate from what our normal procedure is from council, and so I do offer the apology, but as the mayor alluded to, we've been very busy over the last weeks with COVID, slowly, and then ramped up to where we are today. We have followed always the lead of the people who are professionals in the field. That is something that we have always made sure that we have done, and that is the communication that you've seen from the city that's gone out to staff and that's gone out to the public at every different update that we have made. We have followed the lead of the District of Muskoka Health Unit and Dr. Charles Gardner. We followed the lead of the Province of Ontario, being the Chief Medical Officer of Ontario and the Chief Medical Officer of the country. So we have done a very staged response. So typically what happens in a outbreak or an infection type of scenario such as this, organizations such as the Center for Disease Control, the World Health Organization, the federal and provincial public health, and our local public health follow a set protocol, which is a step-by-step approach to responding to an outbreak or infection scenario. And then once we hit a benchmark based on what the epidemiology or the type of virus is, in this case being COVID, then they proceed to the next level. And each of those levels, with it come different precautions. So we started with over a week ago with the precaution for hand washing. We started at the beginning of last week with the social distancing, which is a term was new, we've never heard before. And typically and historically, when we've distanced from people because of potential for disease spread or illness, it's been 3 feet or 1 meter. And due to the actual type and potential for spread and the way that this virus, corona or COVID-19 spreads, they doubled that distance as a precautionary measure. So that's where we are as far as the social distancing and the steps that we took early last week. And the first release that went out to the public and the steps that we took within the city to wash hands, disinfect surfaces, and the video that was produced to encourage the community and also our staff to do that. Having said that, looking at this disease specifically, the transmission of COVID is through droplets. So any droplets that land on a table or any surface or anything, the droplets itself contains the virus. And this is what we've learned from both the district, the provincial and federal and international community. So the type of or ways that it can be spread is through droplets as you exhale them or sneeze them or cough them. And hence the precautions that we have taken and recommended that people cough into their sleeve or into the corner of your arm, and also to protect yourself from all of the touches that you do. That's how we got to where we did with our first recommendation. We've constantly been in contact with the Simcoe Muskoka District Health Unit and Dr. Gardner. We've also been in contact, I believe my first contact with the CEO of Soldiers Memorial Hospital was a week ago Friday, so that would be about the, beginning of the week, about the 9th of March, with looking at precautions that we can take, but also ways that we can assist through our emergency control group, the hospital and the needs and the potential increase in patients that they are going to see. So all of the decisions that we made through the beginning of the week last week through to the end of the week where we got to closing city facilities was due to the recommendation and based on the science and what the district, the province, and the federal government had recommended. I would like to note that the commitment from the Simcoe Muskoka District Health Unit is that they will communicate twice a week with us. And that's what the updates would be on their website. We have, in fact, engaged through the emergency management contacts in the health unit and also Dr. Gardner on a more frequent basis so that we can be proactive in what we as a city do. Unfortunately, the spread of this virus is due to travel, and so the restrictions that have been put in place and recommended sometimes are verbally said but not followed up with the written direction that was given. And that's the specific reason that we contacted Dr. Gardner, for example, on return to work for individuals who are often traveling. We wanted to make sure that we were being at least relevant in any attempt or thought that we should be proactive. We followed the direction that we were given. We specifically asked on 3 cases of staff and their travel plans. We asked, here's the travel plans, here's the return routes, here is the countries they are coming from or even landing in on a transfer flight. And so we made decisions based on the direction given, and the direction given was very specific to each individual. Further to that, we've had the announcement from the Prime Minister at 1 o'clock on Monday, and his written or his verbal word is to stop and to not do travel out of the country. And as you know, he's closed the borders. So the step approach and the benchmark that you reach in each municipality is specific to the municipality. And what I mean by that is Toronto and other places that have more public gathering points and mass transit are in a different place than cities and townships like Orillia and our area are in Simcoe County. But that is the position that the health unit has taken, and that is the direction that we have been following. I would also like to make it clear that, like the mayor indicated, the spread or the amount of information that is coming in and the amount of changes that happen almost at least hourly, if not sometimes every 5 minutes. If I could just give one example of that, I was on the phone with the earlier last week, middle of last week, on the need to curtail mass gatherings. And when I was in conversation with her, the emergency management professional there, it was 1,000. And so while we were in our conversation, which started at 11 o'clock, by 10 after 11, someone had stuck their head in the door, being Dr. Gardner, to say, no, it's now 250. But the direction on the website hadn't caught up to that. So that's why I want to stress the fact that we have been very diligent in following the lead of the people who are the professionals, who are following a path to make sure that they are upgrading and stepping up to the next level based on the history of what they have seen in disease processes, in infections, and in viruses of this sort to be relevant in the direction that they are then giving to the communities. That stepped approach is what they've been following, and that is the direction that we have taken. We have taken measures in many different ways to protect city staff. We've taken measures to protect the community based on the input that we have from the professionals and the experts that are qualified to do that. Through this, we're finding that we are also making every effort to be proactive in how we do that as well, without creating some anxiety or angst in the community. But definitely we want to be on the leading edge of that. So like I said, this is changing rapidly. I do not have the written brief, which I again apologize for, but we are in unusual circumstances and very busy with phone calls and advice and assisting people. So I think, Mayor Clark, I'll leave it at that if that's okay with you, unless I'm missing something, because I know you and I have been in very close contact, and we can maybe just go from there.
Very close contact, indeed, 6 feet apart. Thank you very much for that, Chief. I do hope that you are getting some rest during this, because the next few weeks are going to be critical, and we need you healthy throughout. And so thank you for that. Just want to, I think the Chief covered it off, but we are in constant. I know there was a reference to one more formal meeting with the Simcoe Muskoka District Health Unit twice a week, but I can assure you the Chief is in contact with them every single day, and often many, many times a day, and with Soldiers Memorial Hospital and with the Simcoe County Emergency Preparedness Committee. I called the meeting. Hi, Jay. Hi, Jay.
I think there's a delay between the TV and your recording on here.
Okay. We believe that may very well be the case. It may be something we have to live with, at least for today.
Okay.
All right. Thanks. As long as you've got me audibly, that's good. I'm sure that you and others may not want the video of me. Anyway, the reason I called the meeting, it was suggested by a couple of members of council, but also I wanted to make sure that council felt that they were up to date with all the information. I truly don't believe there's any new information that we have for you, but I thought it would be a very good time for a Q&A. If there were questions you have, which I'm sure there may be plenty, then the Chief and myself and Gail will do our best to answer those questions. But before I go there, I know that there was a discussion and we sent some information out to members of council today, but maybe I would ask our manager of, Director of Communications and Business Development. So thank you. Things have changed there recently too, not quite as rapidly as this other issue, but Jen or Ms. Ruff, if you would be so kind as to give us an update on that. Thank you.
Through Mayor Clark, I thought I would take this opportunity just to highlight, as is in the report before council or the briefing note before council, some of the communications we've put out, and I think it's just a good opportunity to remind council, but also those who may be watching, in regards to some of the updates. Certainly, we do have the Orillia.ca/COVID-19 webpage available to all, and that is where we are trying to provide the most updated information on City of Orillia impacts. Certainly on that page, you will note we are redirecting to health authorities regarding the situation, as we believe that is the best approach. As as the fire chief noted, we are not able to provide as timely of information as they would be able to on the health impact of that. But certainly there have been numerous releases, which we have also communicated via social media, and there will be one coming out shortly as well to members of council, the media and the public regarding our next steps also. Certainly, if you aren't already following the City of Orillia on social media, on Facebook, Twitter, YouTube, and subscribing to our news releases on our webpage, this is a good opportunity to do so in order to stay up to date on all the information that we are sending out.
Thank you. Also, there's the ability to subscribe, if you would.
Through you, Mayor Clark, there is the ability to subscribe to not only our news releases, but any public notice we put out. That means that it would be delivered directly to your inbox the minute that we send it out and post it on our website. Just visit Orillia.ca to do that.
Orillia.ca.
Just our webpage, Orillia.ca, and you'll find links there.
Okay. And the reason I mention that is because we've had a few organizations reach out to say, hey, what can we do? And I think the general belief is that the best thing that organizations can do is to take the information and then resend it within their own links, because education is absolutely key in this regard. So if you can go on the COVID-19 update page, you can, as I say, register on one of our social media platforms or a number of them, and or subscribe on one of the links, and you will automatically be fed anytime we have something going out. Okay. I will now open the floor for questions. Mason.
Yes, through you, Mr. Chair, just a question for the Chief. I'm not sure if you know this. I know you were talking about the droplets specifically in explaining that. I'm just curious, I haven't seen too much on social media, but in regards to how long the virus can kind of remain on something for, if they have that broken down or if they have that information out there. The reason I do ask is because now that we do have a case confirmed in Orillia, I'm sure a lot of people are going to be, sort of freaking out, especially if they, might know the person or something like that, and then giving themselves an idea of, okay, well, how long, was I in contact with this person or something along those lines, just to give them a better understanding if we do have that info.
Very good question. Chief?
Through you, Mr. Mayor, to Councillor Ainsworth and the council, members of council. I don't have an easy answer, and I'm not 100% up on that at this exact moment. I do know they do have some of that information available on the Simcoe Muskoka Health Unit site, and they have a better picture of that through the Provincial site, which we can link to from Orillia.ca. Our COVID banner link on there will take you there. The only reason I don't want to give you an exact answer is there are some variables as far as temperature, size of droplet, and the type of material, whether it's a hard surface or a soft surface. So just because there are some variables there, I would defer to the website to give a better indication, and that's a good resource for members of the community who would have the same question to be able to kind of get a clearer picture than me to mislead someone what they're thinking compared to what we could give an answer for too.
Jen, do you think I could task you with seeing if you have, do you have time to maybe hop on the Simcoe Muskoka District website to see if they give some kind of parameters to Councillor Ainsworth or Mason's question? You don't have to do that right now, but I'll go ahead. But if you do get it, it would be helpful. Other questions? Ralph.
Thank you, Mr. Mayor. First of all, I want to thank the fire chief for his comments and for the hard work that they're doing. Secondly, I have a few questions, Mr. Mayor, but I'll start with this one. Our vulnerable population is the seniors right now with this virus. Do we need to do anything, communicate with the senior homes and everything else more than what we're doing in order to inform them of what to do, and maybe have some kind of a signage, that something like that or whatever? And the second part of that is, through you to our fire chief, is what will constitute putting Orillia on an emergency mode, similar to what the province has done? And what does that entail, and what are ramifications of that?
A couple of good questions. So the first one around our vulnerable sector, which is at the moment, as the data is coming in from other countries.
Oh, thanks.
Somebody give Councillor Sapola some hand sanitizer, please. The vulnerable sector certainly seems to be our aged population. If you're 60, you're a little more susceptible, 70, you're more susceptible, 80 and 90, and so on. If you're male, you are more susceptible. At least that's the data that's coming out of Italy. The average age of mortality there due to the COVID-19 virus was 81, and 75% of the mortalities were male. And also, if you have a predisposition to a respiratory issue, you are also more vulnerable. And if you are a senior and male and have that issue, then you are quite vulnerable. So your point's well taken, Councillor Sapola. And that's
the reason
why,
I asked about the seniors.
Go ahead, Councillor Sapola.
Thank you, Mr. Mayor. The reason I ask about the seniors, because I have a cousin that's 80 years old in Italy, and she just passed away with it as well. And so I want to be extra careful with how we treat this virus towards our seniors in particular. I mean, we all have to be aware, as you mentioned, Mr. Mayor. But I think the seniors are more than that. So I think it's really important that we do something special.
Well, I think your concern is quite genuine. And quite and targeted properly. I can tell you that if you are in a senior's home in Orillia, they are well over this. I'm familiar with. I believe if they all weren't in lockdown by past Saturday night, I believe they all are now. But I believe they were all as of Saturday night. Nobody was allowed in except staff, and of course they've got screening measures for staff. The population that probably is maybe more at risk are maybe the ones that I mean, if you're in a senior's home, it can spread quickly in a senior's home if it gets in, so keep it out. But some of the people outside these seniors' homes where they don't have these certain measures in place need to be very, very vigilant. But Chief, is there a specific comment you want to make around the seniors population?
Yeah, through you, Mr. Mayor, to Councillor Sapola, my condolences to the loss of your family member.
Thank you.
To members of council, through the mayor, there is, first of all, regulation through the health department and through the LIN is the ones that give direction to the vulnerable population through care facilities and through nursing facilities. So their direction comes from the Simcoe Muskoka District Health Unit and the LIN. But as a community, which I think is more to your question, what can we do to help? As much as we love them and want to be with them and they are lonely, to not go and visit. Those are the travel and exposing the vulnerable is a huge component of them being at a higher risk. As Mayor Clark indicated, in your 70s, I think you're somewhere around a 9% risk of mortality once you hit 80, and it accelerates into 15 to 18 and higher, depending on which website you're looking at. And I'm talking about the credible websites. So just not exposing them is the biggest thing that we can do, as hard as that is when you want to, as a family, just kind of surround yourself and look after each other and be together. You can, all of the material from the credible sources, which I keep stressing is getting credible information from credible sources, is that we can definitely be a carrier of COVID and not get sick, but we can transmit it to those who are advanced in any other diseases or weakened immune states that they have.
Chief, I'm just going to have you speak a little closer to the microphone, if that's possible. Thank you.
My apologies.
I'm going to go to Councillor or Ted in a second. I saw my mother-in-law, who lives in a seniors home in Orillia, saw her Friday, and it's likely going to be weeks and weeks before we see her, and quite frankly, before she sees anyone again, because she is self-contained and does all her own work and cooking. Ted. Oh, sorry, I've got Tim and Ted. Sorry about that, Tim and Ted. Sorry.
Thank you, Mayor Clark. Just to follow up on that, it's a comment more than it is a question, and that is that what we are doing right this minute and what is happening in terms of what Jen has pointed out in terms of our ability to communicate on social media and our website is, in fact, giving the population of Orillia and area the kind of advice that the chief talked about earlier. And, it's distressing when both the chief and the mayor speak about the challenges of those of my age. And I recognize that very much. And I live in a seniors community. And within our community, the leadership of the community through the Condo Corporation has been issuing notes to all the residents, giving them advice on how to obtain groceries without having to leave the house and so on and so forth. So there's two things. One of those is that if you are a vulnerable person or in a vulnerable category, then isolate yourself. I've been at home for the last 3 days. This is the first time I've come out. I came out because we need quorum tonight. I'll go back home and continue my isolation there. But for those who aren't as vulnerable, remember that the seniors who are vulnerable can use your help. That's the sort of thing that we as friends, relatives, and citizens of this community can think about. How can I, as an individual, assist those people? I recognize the difficulty that the institutions have because they have to control entrance into the building. But for those who are in homes, in their own homes and things, they may need the kind of help that we can provide. And I think it's absolutely important that each of us think about that in whatever way we can do it. I don't think, Councillor Sapola, that we can mandate it, in terms of ordering people to do things. But as the leader of our country and as the leader of our province and the leader of our city have said in the last few days, it really is a time for all Canadians to recognize their responsibility as citizens and pull together individually to help. So for the vulnerable, stay at home.
Thank you very much. I'm going to go to Tim in about one minute here. Just a reminder for those in the meeting at home, and for those watching, we've got three members of council at home and our CAO. So if you have a question, please just type it in, and I'll throw you in queue. And in the meantime, I'm going to go to Tim.
Thank you, Mayor Clark. First of all, just a comment on the seniors issue. The good news is that seniors' homes are not strangers to lockdowns. That it happens. I don't know how often. I wouldn't care to guess, but every couple of years you hear of a flu coming through, and so I think we can get a little bit of comfort out of the fact that the senior homes do have protocol and do know how to handle these situations, and it's not as new to them as it is to us. I do have a couple of questions, actually about three, so you can cut me off whenever you'd like.
Sorry, and that reminds me, because Councillor Spola posed two questions. So, Chief, I know we had a meeting with that earlier, so I know you're prepared for that, but I'll go to let Councillor Lauer finish off his questions, and then we'll go to answer Councillor Lauer's, Councillor Spola's, and then Councillor Lauer's.
I think I understood that. Okay. First question would be, so we now have been notified that we have a case in Orillia, Soldiers Memorial Hospital. So it's occurred to me that one of the follow-ups has to be notifying people that may have been in contact with that person. And I'm wondering, how widespread is that? How effective is it? And who is doing it?
Chief?
Through you, Mr. Mayor, to Councillor Lauer and the members of council. That is done primarily through the LIN and through, as is the responsibility of the Simcoe Muskoka District Health Unit to make sure that fan out of information happens. They have the investigators who then have the power and the ability to, beyond what a normal citizen could, get a hold of people's numbers and do some research and the investigation to find out who potentially has been exposed, and we as a city have offered to Soldiers Memorial Hospital if we can help in any way, but they already have these measures in place. They already do this routinely when there is a local issue of outbreak or someone who has if I could use, meningitis or a bad flu or any other type of illness or virus. So this just becomes a bigger job for them, but they already have those measures in place to be able to look after and do those notifications and the investigation of where and who they have been in contact with and do the notifications.
Okay, so if I worked at, just for argument's sake, Kubota, and that individual was from Kubota, and there's no truth to that at all. I'm just using it as an example. Then the LIN would let the employees that may be affected. That's an automatic.
Yeah, through you, Mr. Mayor, they would definitely do that. The notification be through the human resources or the health and safety at Kubota, and they would work in cooperation with whatever business or whoever they need to make the appropriate notifications based on who would be exposed at any location or any place.
Okay. I want to be perfectly clear. That was a hypothetical.
Yeah, that's definitely a hypothetical
situation.
But where I'm going with it,
completely hypothetical.
If you are, obviously everybody's in the work, not everybody, but most people are in the workforce, and so you can take a bit of comfort on the fact that if it is affecting you, you will hear about it.
Thank you. And Chief, if you'll be so kind as I think the question around the state of emergency is, when might we consider it? As I say, I know it was a part of our discussion earlier today, and what are the ramifications of?
Sure, through you, Mr. Mayor, to Councillor Cipolla and the members of council. Declaration of emergency is something that is certainly on the table and within our ability to do. I will start with the fact that I don't think we're at that point yet, in my opinion, and based on what I'm seeing in our community. Having said that, there are a couple of local, one local, and then actually, while we've been in this meeting, the county has declared an emergency, but Tiny Township also declared. And that, if I can speak specifically to Tiny Township, that was around their need for the ability through their plan and their continuity of operations to be able to enact some policies and things through their emergency plan and their pandemic plan and their continuity of operations to be able to operate because of the unusual circumstance they were in. I can only speak in part to the county. I'm not going to pretend to know their whole reason for declaring an emergency, but I was on a phone call this morning with all of the CEMCs, or Community Emergency Management Coordinators, in the county, and they mentioned the fact that they may activate. That is to do around with their, in part, and I'm not suggesting this is all inclusive, but their reporting can be done through their emergency management software, and all their decision making and flow, as would ours, goes through their emergency operations center. They are able to have the multiple staff that they need to make that happen. And given the size of the county, that is an appropriate decision they feel for them at this time. If I can speak directly to Orillia and echo what Mayor Clark said, I don't think, or I don't see us in the place where we need to declare an emergency at this point. But I certainly will be the first to recommend when I feel that we do, or if we get to that point. So what does that mean? Well, currently, without us declaring an emergency, we have an emergency control group, which has most of the members of the senior leadership team on it, or their alternates, plus other appropriate city staff that lend expertise to what we would need in an emergency situation, as well as outside partners, so Soldiers, Orillia Power, OPP, and then others as we deem appropriate, as well as some representation from the county emergency management. Currently, like I said, us as the city of Orillia, our senior leadership team is meeting regularly. The mayor and the CAO and I and the director of communications and business development meet very regularly, sometimes at an hour by hour, to do what we need to for Orillia and come up with the best case and the decisions we need to make. And that is really considered a committee of the emergency control group, and we're able to do that effectively now. Should we get to the point where we need to declare an emergency, certainly we can do that. When we declare an emergency, there is an actual and a set process under the Emergency Management and Civil Protection Act that we have to follow. And when we declare that, we have to declare that to the province. That gives us special powers in the fact that all decisions, not unlike I just mentioned with the county, all decisions would then be made by that emergency control group and the person in charge of that control group, or the alternate. So even decisions about, and this is not exhaustive in any way, but probably relevant would be decisions on purchasing, decisions on alterations to a bylaw that need to be made to mitigate whatever the emergency is. All of those things are then made by that group, and then just the information is disseminated out to those through our already in place communications protocol. So certainly we may need to be at that point and get to that point. That does require additional staff, because we then need to convene either virtually or in physical form at our emergency operations center. So our staffing would need to be there, as well as the other forms and things that we need to do to keep the city of Orillia going. So it is a bit labor intensive, but certainly within our ability to do. In addition to that, what we would need to have then, or we would have at that point, is representatives from the province and from the county and others that deem that they need to through the Provincial Operations Center would then provide support. And then any things that we need, we can then get and draw on from the province, and the funding structure at that point is based through the province. Now, having said that, so if I'll maybe leave that at that point unless there's any questions on declaring versus not declaring. So if I can leave that for us, I'm very confident in the way that we are making decisions now and the way we're able to get information and then disseminate that information appropriately with the unified messaging that we are. The funding piece, because the province has declared an emergency, that changes under the Emergency Management and Civil Protection Act how a funding model in a declared emergency happens. And I'll be frank and say that I don't know what that looks like because it has never been done before. So that is being evaluated. I know on a call I was on, I believe it was yesterday, with Minister Clark and Minister Elliott and the Chief Medical Officer for the province, Williams, that was on their table discussion that was going to happen, and they were going to make some form of announcement as far as what funding will look like on this declared emergency by the province and how it would impact municipalities. So that is certainly a consideration, obviously, for a declaration of emergency. But because this has never happened in Ontario before, to my knowledge, or well, I've been involved with emergency management. There's the experts and the people that need to make those decisions will and will follow suit with what we need to do for Orillia. And if that means we declare because of the funding as one piece, we will certainly do that, whatever's in the best interest of our community, but also our city.
Thank you. Good question, Ralph. Thank you very much for that. I have Jay in queue. Jay, I believe you have a comment you'd like to make?
Can you hear me?
Yes, indeed.
Great. I'll go ahead. I want to ever from Italy, from Mulan, from the international, really take this meeting with a friend of mine of quarantine over in shut down, except for essential. As the county has just done, throwing them out. Inside of Canada.
Thanks for that, Jay. Thanks very much. As you well know, hopefully, I'll make it a topic of discussion around the table at some point during the meeting that we are taking an extra measure that we are announcing today. But we can have that discussion a little bit later. And you're right. One thing during that same phone conference call that the chief was alluding to with Minister Clark, Minister Elliott, and the medical officer of health for the province, they were indicating that because of the measures taken in Canada and the measures taken in different countries, the threat to Canada from China, Italy, and Iran have been much, much, much diminished. The threat is actually from people coming back from the United States. And I think that was probably the reason for the extraordinary measure taken today by the federal government to close the border. Anyway, Jay, thank you very much for your comments. We certainly heard the chief's point on the state of emergency. The comment I would add to that and your suggestion is whatever is real at this hour will be different next hour and the hour after that. So we are having meetings on an extremely regular basis, many times a day, many hours a day, and we have all these tools at our disposal, and they may very well come into play. We'll just make sure the timing's right. Councillor Emond.
Thank you, Mayor Clark. Just 2 points. I've just got a notice that those at home are having trouble hearing Councillor Follis. So until that corrects, you might want to paraphrase the comments that are coming from those off here. We can hear them, but and Rogers, from what I understand, has indicated they're trying to fix that.
Okay. Thank you. Sorry.
Okay, that's just.
Oh, I'm happy to.
You can do that if you wish. I will do my best to paraphrase once Ted's done.
But I will continue to make the comment which reinforces, I think, the point you made, and certainly the point the Chief made earlier, is that things are happening so quickly that sometimes we appear to be running to catch up. And that's a real challenge for us, because a decision we make, say, on Monday of this week, based on the information that's available on Monday, by Wednesday appears to be an incorrect decision. And so I ask the patience of our citizens to recognize that if they're using the criteria of Wednesday to judge what decisions the city has been making on Monday, they may be imposing upon us the need to be clairvoyant in terms of figuring out what that is. And I can tell you today we're making some decisions. On Monday next week, it'll likely be that we are perceived to need to make additional decisions. And at that point, everybody will say, well, why didn't you do it before? Well, because of the very fact that the advice we're getting from the professionals, the things of that nature, are not necessarily yet leading us in that direction. I'm not sure in many cases what we would do, because we need to have that collective advice of the folks that are there. And it's appropriate, as Councillor Follis said, to look at the advice we're getting from other countries and other experiences, but they have to be brought into the Canadian context, and they really need to be filtered through those who are skilled and capable of making these decisions. And I know that the clinicians in our hospital and those throughout the country in public health are spending the time and energy to try and guide us on this. And so patience is absolutely critical from everybody's point of view.
Thank you, Ted. So Councillor Follis was suggesting to us he has a friend in Naples, which is in Italy, of course, and is in day, I believe he said day 7 of being quarantined. There is a difference between quarantine and self-isolation, but apparently in quarantine, and was indicating to Councillor Follis just the rapid transmitting ability of this virus and how devastating it can be, and was suggesting that we take all measures possible. And Councillor Follis also was talking about the state of emergency, which the chief had mentioned. I also agree with Councillor Follis and Councillor Emond that we are learning lots. We have learned something from SARS. We have learned something from H1N1. But I'm going to suggest most of the learning, and thank goodness that Canada wasn't the first hotspot outside of China, because as northern Italy seemed to be, and then Iran, and then and now I think Spain and a couple other countries. So I think Canada's had the chance to learn from what was going on, in particular China and Italy, and been able to take steps for that. But you're right, Jay, that we definitely need to learn from that and put all measures in place that we can. I will look around the table now for anybody else wishing to ask a question. Ralph, then Tim. Okay, Tim, then Ralph.
And Ralph, thank you, Mayor Clark. Just going back to the chief's opening remarks and report, I'm curious about the decisions on the whether or not to self-isolate after travel. And you mentioned that there were 3 cases and that you petitioned Dr. Gardner for answers. And I'm just wondering, what would his decision be based on? What was his rationale? And is that an option that's available to everybody to contact him and get clearance?
Chief?
Through Mayor Clark to Councillor Lauer. So his decision-making ability is based on his medical degree and his expertise in public health. As far as can we ask the question, yes, we can through proper channels. That's why I was able to answer or ask the question of the doctor directly. I don't think you will have the ability. There certainly is the ability, if I can kind of rephrase that, there is the ability for anyone from the public to call the hotline number that is posted on the Simcoe Muskoka District Health Unit. But if you go, I have that banner up right in front of me now. We're currently experiencing significant call volume on our phone lines. Thanks for your patience. If you're concerned about your health, call your health provider or call telehealth. So to answer your question, we do have the ability on a case-by-case basis through other channels to ask the questions if we have specifics. At the same time, we will be respectful of the doctor's time and all of the work that they have to do and vet whether the question is appropriate to ask or if the answer is in fact available on their website, we will default to that. But if we're at all unsure, we do have the ability through our channels to do that kind of questioning and level of questioning if we need to.
One thing I neglected to mention earlier, because as I said, there's 5 or 6 things that we can do as citizens to help mitigate, and you're going to hear them relentlessly maybe today, and you're going to see them every time we put out communication on this issue, and certainly social distancing, washing, sneezing into your arm. If you're sick, stay home. But also, if you suspect that you have an issue, do not go to emergency. Do not go to your primary caregiver, which is generally your doctor. Not always, but do not visit there because they will not. My understanding is they will tell you to go home or call because you're putting other people at risk. The province launched a couple of days ago, and the chief may know the exact name of it, but it's on the provincial website, is the self-assessment tool. And that just kicked off a couple of days ago, and that will walk you through basically helping you determine whether you may need to go for testing or not. And if you need to go for testing, that's when you make the phone call to either Emerge or to your primary caregiver, as I understand it, and they will give you direction from there. Ralph.
Mayor Clark, if I could just follow up on my first
follow up, sure.
Yeah. Okay, thank you. As I'm understanding it, we're asking the question of Dr. Gardner, and he's making some assessment of the travel flight plan and the country that's involved and things like that, and declaring that it sounds like that there are safe countries and there's not such safe countries. Just for the record, I disagree with that, I'm not sure how he's making those decisions. I'm sure he's got information that I don't, but just for the record, as we go on, if there are more requests, because I assume there's a lot of people that may still be away, I am not in favor of asking the question.
The things have also evolved, though. That was the case a number of days ago, but as of Monday, everything changed. Monday afternoon. So anybody coming from any country outside of Canada, I believe, is requested to self-isolate, but I'll let the chief jump in on that.
Yeah, through you, Mr. Mayor, that's absolutely correct. In my opening statement, I said that the approach taken to any type of outbreak, viral, bacterial, or whatever it is on a step by step, and once we reach a benchmark, we go to the next level. And so as Mayor Clark eloquently said, we are at that level now with the announcement of the Prime Minister on Monday. And to echo Councillor Iman's comments a bit ago, that each of these steps will then enact a different level of response. So that negates the need to go on a case-by-case basis at this point, because we're at the step where, like the Prime Minister said, we're canceling all travel, we're closing the border, and unless they're Canadians and so on and so forth, according to his announcement. But also to echo Councillor Iman's point of a bit ago, our hindsight on this is perfect. And so when we're not at that step, even though we are, as a city, are often taking a more proactive approach than even the step we may tend to be in, this truly is changing hour by hour. And decisions made even today, this morning, were changed by this afternoon. We convened twice as a senior leadership team today because there was a change today. So we're being very generous on the proactive side when we're within the guidelines that we're given now to err on the side of being more proactive than behind the curve. But sometimes that is even changing moment by moment. So we are at that point, and so to your original question, through you, Mr. Mayor, to Councillor Lauer, is we're not at that point now where we're asking case by case. On Friday and Sunday and Monday we were. Monday morning we were. Monday afternoon that changed.
So there are no individual cases anymore. Everybody is requested to self-isolate. Councillor Ruff.
Thank you, Mr. Mayor. Just to Councillor Lauer's question on thing, there is no safe country because you're traveling through airports and you're traveling on planes. So as of this morning at our conference call with the health, the Simcoe Muskoka Health Unit, returning from out-of-country travel in the past 14 days should go into home isolations for 14 days, apart from healthcare workers and workers of essential services. I think that's pretty clear for what you're saying, Chief. But one of the things, one of my questions, Mr. Mayor, is we heard from the government this morning that there's a 6-month mortgage deferral, student loans are deferred, everything else. But yet, I'm wondering if we as a city can help some of the people that are working in retail, working in their plants are shut down or their offices are shut down or the retail stores are shut down, as we saw on the main street of Orillia. It's the first time in 49 years, Mr. Mayor, that I've seen on a weekday that the whole street is almost a ghost town sort of thing, and it's not. I don't know how to explain it, but it's not. It breaks my heart to see that happen because some of these people that are employed are living paycheck to paycheck. So here's my question to you, Mr. Mayor, and to our staff: Is there anything we can do to? We charge interest on back taxes or on taxes that are that, and can we even go that cash to go to the waste diversion site? Can we forego any of that stuff? It's only in questions of dollars and cents. There's not a lot of money, and that. So, what can we do financially to help our people in this community and the businesses in this community to be able to afford to exist, basically? And I asked that, and I have 2 more questions after that, Mr. Mayor, and then I'm done.
I'll put you back in queue. I think you've asked a terrific question. I've had that question asked of me a few times the last few days. I can tell you at least initial discussions have begun in City Hall, and I'm going to start the answer, and then I'll ask Gail to jump in. Certainly the feds have announced extraordinary financial measures. The province is beginning to do the same thing. There may very well be something that we can do. Right now we're as I say, we're just entering into those discussions. We'll make that part of this whole process, and may have to come back, depending on the situation, may have to come back to council if we're going to go in a certain direction. There are some things that, as I know, have already been discussed already, and maybe I'll ask Gail if she would to jump in at this point.
Thank you, Mr. Mayor.
Yes.
Go ahead.
Thanks, Mr. Mayor. Yes, Jim and I have had multiple with respect to this issue, whether it be related to water. And we invite and that's the reason why waiver of interest with respect to some of the conversations that the financial end of things. As I indicated, potentially early next week.
Indeed, thank you for that, Madam CAO. And Ted?
Thank you, Mayor Clark. One of the things I think it's important for our citizens to understand is that the financial structure of a municipality is very different than that of a province and a federal government. We don't have we can't operate as a deficit in that sense. So, and when the federal government announces, as it did today, $80-some billion worth of support for individuals who are suffering from this, financially suffering from this issue, and for as well for small businesses, those are the sources that those organizations need to be going. We can facilitate access to that if that's a role we can play. Part of what the federal government is doing is deferring. As you say, you don't pay your tax until August now. And by the way, if you have paid your tax and got your return, you don't have to send it back. That was part of it as well. But the point I'd make is that we could potentially, as our CAO has just said, defer a number of things. But we're much, much more limited than senior levels of government in our ability to actually hand out monies. So I think we have to very much here coordinate with what the province is making available and what the feds are making available, because they're the vehicles by which we flow those monies to individuals.
Great, thank you for that.
Mr. Mayor, if I can answer Councillor Eamon, I wasn't looking for handouts.
Go right ahead.
I wasn't looking for handouts. I was saying the things that are within our control, such as your interest on the taxes, such as charging at our landfill site to people to bring their garbage in, when that kind of stuff for $5 or $10 a charge, that's peanuts. But what we can do that's within our ability to control. And you're absolutely right. The federal government has put $82 billion into it in the province. This morning's meeting, the health unit is $600,000 because of extra staff they have to hire and everything else. So they're going to the province for it, and we can do the same thing. So just a comment to your comment. But
okay,
I have another question, Mr. Mayor.
I understand, Councillor, but I want to make sure I'm getting around the table. So if there's nobody else in queue, then I'll come right back to you. Other questions? You're back up.
Thank you, Mr. Mayor. I'm just two other questions. If you, Mr. Mayor, and our chief can do a live stream at least once a week or twice a week or whenever it's, not when it's necessary, just so that we have some kind of a set goal saying, okay, we're going to do it every 2 days to bring the citizens of Orillia up to speed, up to information, because some people don't have internet, some people, whatever, okay? And I think if we can do that, and the press will pick up on it, but I really think that's an appropriate thing for you and our chief to do is a live stream so that people can listen to what you have to say, because your information is well thought out, well presented, and I think people will listen rather than read it from some website that's out of the States and everything else. One of the other things, and the reason I say that is because there was on the news media that said, if we're not careful, if we don't do the prevention, this could be one of the worst viruses, one of the worst things that we as a human race have to deal with over the last 100 years. So that was on the news, one of the news in the States this morning. So I wonder, through you, Mr. Mayor, if that's possible for you and the chief and whoever else you may want to bring to the table to do a live stream through whatever.
Yeah. Well, first of all, I think it's a great suggestion. I can tell you it's already begun. It's not necessarily a live stream, but it's a video that to record with specific information, specific message. We did one last Thursday. I think it went out on Friday, and the plan is to keep doing a staging of those. I also will commend Rogers, who are broadcasting this meeting, because they have. I think demonstrated great civic responsibility and leadership in the last few days. They are turning a lot of their resources into COVID-19 and getting the word out. So they did a piece with me yesterday, another video that will hit the airwaves imminently as well. So you're bang on your suggestion, and it's already happening. And maybe our director of communications and business development would like to weigh in on that.
Certainly. Through Mayor Clark, communication certainly is very important, and we've thought it through very carefully, and certainly are trying to get information out as quickly as possible. We are also cognizant, though, that there is a lot of information going out right now, and we just don't want to confuse people either. Hence why we've been very committed to providing City of Orillia impacts and the information that we are able to convey, while also directing people to the health authorities that are up to speed on all of the developments. So certainly we will continue to communicate in a variety of ways, one of which being the video, and we will continue to do that. But I just want to stress that if it's not constantly, that is a thought-out effort in conjunction with the fire chief to not inundate constantly with different messages from different sources. Yeah.
So, Mr. Mayor, I was just hoping
thank you, Jen.
I was just hoping that you set a schedule of once a week, whatever is convenient for you guys, so that people know the exact time and date that you guys are going to speak. So, but I'll leave that up to you in your better judgment. My last question, Mr. Mayor, is to do with the festivals and events that we're having in our community. There's quite a few of them going on between now and, say, September, and the liability to us as a city might be horrendous. And especially if this goes on. And we're going to need a lot of notice. For instance, what the Chamber puts on at the waterfront and what Mariposa Festival. And we need time in order to either cancel the performances or cancel the events and that. So I think the city has to decide, we as a city have to, as politicians and as leaders in our community, we need to decide, are we going to allow this to happen for the next 6 months or 8 months or whatever? And what information do we need to make that those suggestions to the people that are organizing this and say, okay, you really should think about doing this because of this, and this, and this. So just want your comments on that.
Sure. Again, a very good suggestion. That's all part of the planning process that we find ourselves in. The initial discussion on festivals, I mean, we were following the lead of the officers of health, again, the medical officers of health, when it was 250 people, and then we said, okay, we got to cancel A, B, C, D, and E because it met that criteria, and we also associated a time frame with that, which initially was up until about May 1st, That will be looked at probably frequently, probably every couple of weeks, and we'll extend that time, whether middle of May, end of May, middle of June, as we know where we are going forward. But now that number is also not 250. It's 50 people. I think it was 50 people as of this morning. It may have even changed since then. I'm not sure. I can tell you that almost anything that I was involved in, because my schedule fills up with a lot of events of various natures, and they have all been canceled by the proponent. And so we will get cancellations from the proponent putting on these events, or we will have to make a decision ourselves. And so great suggestion. That will be looked at with some frequency, and we'll probably do that again next week, and we'll go well into May, I would think. That's where I believe we'll probably look.
Thank you, Mr. Mayor.
Other questions or comments? Councillor Tim.
Thank you. Just along that same vein, this 50 in one room to me is baffling. You have 50 people in a hall that'll hold 250. Well, maybe that's not too bad. But if you have 50 people in my living room, that's not so good, I don't think.
But you can't do social distancing then.
Exactly.
So those two things together, I think.
Well, I don't know. I just think it might be one of the numbers that disappears fairly quickly. But if I could ask a question through you, Mayor Clark, again to the fire chief. As mentioned previously, this is a fast-moving issue. Obviously. I mean, we're all blown away by the fact that I think a week ago we were talking about, musing about whether we should close our library, right? Or whether we should close our rinks and things like that. And certainly both have been closed very quickly, and in hindsight makes perfect sense. Going forward, from this point, let's put ourselves, instead of going back a week and regretting our hindsight or whatever, if we were to look forward in a week, what are some of the actions or measures that may be taken down the road if things tighten up?
I will start off, and that's okay, and then the chief. I sent an email out to all members of council today to tell them of something that SLT, we're working on today, and that is that we're essentially shutting down virtually all city operations, and that will be effective tomorrow morning, and so that's an example, and asking and so the staff will not be interacting with staff. There are some critical services that we need to maintain. Water, wastewater, for example, and they've got a plan in place for that. But that's this morning that wasn't going to be the case. This afternoon that became the case, and so that's one more stage that we're going to. But Chief, if you wish to jump in, please do.
Sure, thank you. Through you, Mr. Mayor. Yes, this is, as we've said numerous times, changing very quickly, and I will suggest to you, and I am, my emergency management hat is to err on the side of caution, and that's certainly how I anticipate this moving forward, and will be my recommendation moving forward. If we get any inkling of us being behind the curve, I'll be the first one to put my hand up and say, no, we've got to be ahead of the curve for the protection of our community and of ourselves. So what that is going to look like, it does change often. Like Mayor Clark alluded, we were taking those steps within the city and city staff tomorrow. And so I would suggest to you, just like my comment earlier, where the number went from 1,000 to 250 in 5 minutes, we're at 50 now, and I can confirm the number is still 50 to Mayor Clark's point, and that's as of March 16th. And if we're seeing, now that we've seen a case here, as we've been in this meeting and it's been posted in Orillia, I myself will be looking at the risk, and do we need to be more proactive? Certainly that is going to be my recommendation. If we need to take further steps and do it quickly, that we will certainly do that. As far as specifics, that will depend on how many cases we get, how busy Soldiers Memorial Hospital becomes. On that point, they are in the process of trying to open our own assessment center here, which is something that I'm not going to put in the mouth of Soldiers Hospital, I know they're actively working on that, and that's no secret when it's going to come in. It's hopeful that it's imminent, but those are other steps that we can take to protect the community, and we'll take those steps as necessary and as soon as we can proactively to protect people.
You know, it's funny, Councillor Cipolla and Councillor Lauer remind me, it was just a week ago last night, I was sitting there watching the NBA. That was 7 days ago. That's right. And so what has changed in the last week is unprecedented, is phenomenal. And Councillor Cipolla, to your point, looking down the main street and seeing it as I heard somebody coin the phrase silent spring. And in many ways, it's going to be, at least as far as commerce and a lot of it are social interaction. And I will tell you, more on a personal note, that one of the most emotional things I've done in quite some time is have to lay off 55 people. Some with very good wherewithal and some with not amazing wherewithal. So we're going to have to find ways, creative ways to take care of these folks and other folks. The assessment center, as the chief alluded to, is another staged approach. So this will enable people to not have to go to the primary caregiver, not go to emerge and potentially affect other people. That they'll do the self-assessment, and if it's necessary, they'll go to the assessment center. If it's necessary to be tested after that, they'll be tested. And they've got very strict protocols in place, but that's something else, as the chief says, is imminent. So I would stand by for that. Other questions, comments, discussion? Dave. Sorry, Mason.
Thank you, Mayor Clark. You just mentioned shutting down city services. What does that look like? I mean, if a member of the public calls City Hall, is someone going to answer the phone? Like, what does that mean to people?
I think I'll defer to Madam CAO on this, if you would, please, Gail.
We will be releasing ensuring that member answer the phone to be able to ask, for people to be able to ask. We do not believe at this stage that we want to now get a call back. We will have one member of staff majority of our sent home, rolling that out.
Thank you for that. So I think it's, I don't know what the audio quality is like at home, so I'll just kind of reiterate the question. And so we talked about bringing the city to a virtual close, if not quite a complete close in some aspects. And the question from Councillor Campbell was, what does that look like? And it's essentially shutting down public access, which we've already done, physical access. And as Gail has indicated, well, there'll be a staff in each department there to answer questions so that you're not just getting a recording, and which is something that the city does on a regular basis. When you call, you actually get a human being, and so that was a very good consideration. I'll commend SLT for doing that. On that, Ted, then I'm going to go to Mason.
No, Mayor Clark, just to confirm that the sound is not coming through for Gail. So okay. Thank you for reiterating the point she made.
Thank you. Well, I was doing that at your suggestion. Mason.
Yes, through you, Mayor Clark, to further expand on Councillor Campbell's point, I think it's great that there's going to be folks from different departments answering the phones. My question is, I know it was mentioned in regards to essential services remaining open. Obviously, wastewater is an important one. What other ones are we looking at for that? Is the fire department still going to be at full capacity? Are we going to have the roads crews out, getting rid of the snow? Is garbage collection, going to continue on a regular basis? Or what does that breakdown kind of look like? Obviously, we've already talked about things like the museum and, recreation, the opera house closing down. I'm just trying to give folks a better understanding.
Very good question. So, Gail, did you hear the question? Gail, are you there? So the question was, Gail, from Mason, if we're shutting down, virtually shutting down operations, and we do have some critical services we need to maintain, which ones are we looking to maintain? If you can.
Thank you, Mr. Mayor. Hopefully you can hear me, and if not, I guess if you can hear me, if you can reiterate for the folks at home that can't hear. So fire is an essential service. So fire will continue operating as they have been operating, and Brent can elaborate a little bit further on that if that is necessary. We have our water and wastewater system that will continue to be, our critical services continue to be in full operation. We will have staff to ensure that if we have a snow event or a weather event, that the roads are appropriately maintained. Waste collection will absolutely continue, but your access to the landfill site, residential individual access to the landfill site will be discontinued for now. So the instructions to staff at this point in time essentially is starting first thing tomorrow morning and will continue for a 2-week period, and we will be assessing as we go through. But those kinds of services will absolutely, the critical services will continue. And if any member of the public has a question with respect to a particular service, certainly reach out and give us a call, and we'll be able to respond.
Great, and my understanding is that audio was coming through to the folks at home. But I will reiterate, because it was a very good question, probably critical. So we will be maintaining certain services that are we see as essential, if that's not the dictionary definition, maybe critical. Certainly the fire services, water and wastewater for what I believe are obvious reasons. Operation, as Mason asked, if we have a snow event, we will indeed have people to address that. And waste, which of course includes garbage, recycle, and organics pickup, will continue as scheduled. So thank you for the question, and thank you for the answer, Gail. Oh, and certainly transit, as I understand it, is certainly continuing. And I will say, with respect to transit, like we've done at City Hall, and like hopefully everybody has done in Orillia, the level of maintenance, I'm sure was adequate before, but now has been enhanced to a significant degree. They are cleansing with a commercial product on a nightly basis, and as well, the drivers throughout their shifts are sanitizing regularly the high touch points on transit. But I also encourage you, if you have your own wipes and you have your own sanitizer, to take that with you as well. Thank you. Pat, I hear you have a question.
See, we were talking about essential services. What's going to happen about the construction down on Front Street and also the rec center? I can answer that, Mayor Clark, if you like.
I just wanted to reiterate the question first, if that's okay. So the question from Pat, Councillor Heen, is what's going to happen to the construction that is supposed to begin in earnest very shortly on Front Street? And Gail, please.
Through you, Mr. Mayor, we've been in contact with the selected contractor who will be doing that job. They will be starting, and they will be moving forward with the construction of Front Street. One of the areas that we will have to turn our minds to will be the inspections that will be required, and those inspections will start essentially after April 1st. So we will assess that as we move along. The construction at the recreation facility continues and will, to our understanding, continue. And so there will still be capital projects that are moving forward. And if I can just perhaps clarify one step further, staff will be working from home. So there will still be work done on, for example, development files and economic development questions or anything along those lines. There still will be work carrying on. It will just be potentially limited to any kind of personal contact.
Thank you. That was a good comprehensive answer. So I'm hoping the audio was fine. If it was fine, okay. So I will not paraphrase what was just said. Further questions or comments?
Yeah, Steve, through you.
Go right ahead, Rob.
Yes, my question is very similar to Councillor Heen with the construction at the rec center. With this being an airborne illness, is there any opportunity we should be turning on our air handlers at the facility to see maybe if we need to do a dry run on them and maybe get the filters changed so that there isn't any incidents in the future, that we're going to be a clean and ready to go facility?
Okay, I'm not. I think the chief seems to have understood what you said. So, Chief, could you reiterate the question and then maybe the answer?
I don't know if I will reiterate the whole question. I just want to be very clear that this is not considered an airborne in the traditional sense. Airborne, given that we're in an unusual age, I'll be blunt. If you cough, sneeze, or have any other fluid or droplets that come out of your mouth, that is the only portion that is considered airborne. This isn't like tuberculosis or Legionnaires or anything else where it's floating in the air. It's strictly droplet given and transmitted. And the only time that it can be considered or construed as airborne is as those particulates leave your mouth in the droplet form until they land on whatever surface that they land on. So,
okay, thank you very much. And my next question was for very similar to Councillor Sapolo, where you asked about the Perch Festival. I've gotten calls as well. Will those events continue as planned, or do we have to mitigate some risk because we weren't able to go to the sportsman shows and give a little more exposure to Orillia? So I don't know if it's going to continue or not.
I think the safe answer is, as this situation continues in the manner it is right now, or even worsens, that there will be no such event. But those things will be looked at, as I say, on a frequent basis, and we'll be canceling them with so many weeks' notice. And right now we're canceling until the beginning of May. And next week I suspect that we'll get together and look at probably the month of May as well. But good point.
All right, thank you.
Thanks, Rob. Ralph.
Very quick comment. I just informed that the question, in our business, we get a lot of shipments wrapped in plastic because they come from Europe or wherever. And they found that it remained virulent on surfaces for a lengthy period, from up to 24 hours on cardboard and up to 2 or 3 days on plastic. So that's one of the things that we might want to be really careful on, and maybe the chief can elaborate on a little more on that. But the plastic holds the virus for 2-3 days.
I'm going to suggest any surface whatsoever that you're touching, that you either sanitize it before you touch it, or you touch it and then you sanitize immediately after. But it is virulent. It is water drop based. It's the surfaces that need to be kept hygienic, and it's 20 times more virulent than the normal flus. Mason.
Yes, through Mayor Clark, I'd recommend especially members of council to look at facts. If you do look at the World Health Organization, which we have a link through, through the county and through the city's website as well. It does touch on all of the things that we've talked about, especially in regards to services and such. It doesn't give specifics because there are so many variables. It can last anywhere from hours to days, but it doesn't get into specifics in regards to, whether it's plastic or cardboard or things like that. So I just would say, we need to be careful in that regard. Obviously, people are already freaked out enough as it is, and we want to make sure that we are sending them to the right information.
The WHO is certainly a very valid information source. Chief?
Yeah, if I could just add to that. Through all of this, I have spent much time vetting information, so I can't stress enough the need to vet the information. What we've navigated in the last 10 days, even around people's return to work and around travel and around precautions, recommendations. We live in an information age, which on one hand is great, but on other hands, when someone interprets it to shorten it to fit into a hashtag or into a Twitter post, the important words get changed, and then the wrong information gets out there. And that's just a general comment because I feel that's a very important point to make because I've spent a lot of time vetting information for a lot of the decisions we've made as a city based on a change of even one or two words, which changes the whole intent. I completely agree with the comments through you, Mr. Mayor, to Councillor Ainsworth and Councillor Sapola that there are varying degrees and levels as far as how long a virus, and especially COVID with what we're dealing with right now, will live, if I can use that term. But we can be proactive as we are with our disinfecting. Warm soap and water, even on plastics or cardboards or any surfaces, will get rid of the virus. So if it's untouched and it's not disinfected, I'm starting to wear down and watch my grammar. Then it will live. But if I could use the example of how we can help our community, like for example, my family, because I'm busy most days, has gone to our neighbors with a piece of paper to say, hey, if you're stuck at home, you need us to pick up groceries, that kind of thing, great. But having said that, we're going to sanitize with wipes or whatever appropriate cleaner the bags we pick up, and then we take them to whoever needs it. And so as much as that stuff can live for a long time, how we handle it, how we clean it and react and act with it will be the game changer on how long it lives.
Yeah, we actually have the ability, if everybody bought into this and did what they were supposed to do, to truly mitigate the effect of this virus. Further questions, comments? Ralph.
Sorry, Mr. Mayor.
That's okay. You're good.
Fire Chief Brent Thomas, his report also had wash your hands, and then it had 1, 2, 3, 4, 5, 6, 7 items to do. I'm wondering if we can put that on our website as an ad, not an ad, but something like that people can print off. That would be helpful to some people that aren't aware of what's going on. So, that was a really well done report, but I think your points are well taken so that you have the 7 points that are really, really important to us as humans. And I think if it's done in a artistic way, people will put it up or share it with their neighbors and that kind of stuff, and especially with the seniors.
I can assure you that it is on the website. I can assure you it's in every communique that leaves this city hall. But the suggestion of making a printable version of that, maybe Jen, you could address that?
Through you, Mayor Clark, certainly it is on the website, which anytime, I just want to reiterate, every time you visit the City of Orillia website, there will be a notice bringing you to this page. You have the option to go there, or a banner that clearly says where you can get more information. Certainly in terms of putting it in a more visually pleasing way, it's on the list, certainly for some graphic design support to be able to get these communications across in different ways. But I will reiterate too, there is a lot of really good information on the website that does contain that, and posters for information that people should be following.
But in all fairness, Mr. Mayor, I think this will relate directly to Orillians if it comes from us. rather than having to go all different websites. And as the fire chief said, just don't look at all the websites because some of them may be.
Just to be clear, it is very prominent on our website and in all of our communication, but making it more appealing is something that we can take under advisement. Thank you. Further questions or comments? Okay. Listen, I want to thank everybody for their participation. I want to thank our IT for getting us set up and working out the bugs. This is going to be something that evolves probably very quickly because there may very well be the need to meet again. We're not sure what's happening with our meeting schedule over the next month or two. We may be able to maintain it, as I say, electronically, but I will look at our tired IT staff over there and present them with this challenge, and I know they're up to it. So there is a motion on the screen there, if somebody would be so kind. Thank you, David, and thank you, Mason. That the briefing note OFD, really Fire Department 2001, dated March 18th, 2020, from the Business Development and Communications of Fire Departments. Departments regarding an update, thank you, Megan, with respect to the novel coronavirus COVID-19 be received as information. Before I go there, maybe our Director of Communications and Business Development would just reiterate what people can do if they're looking for information. I know we've talked about it a few times, but maybe just one more reiteration.
Through Mayor Clark, certainly I would encourage people to follow the City of Orillia on social media, which is Facebook, Twitter, and YouTube, and certainly keep checking back with the City of Orillia website, orillia.ca/COVID-19. As mentioned, that'll provide frequently asked questions in regard to city services and city impacts to this, and we will also be directing people to the Simcoe Muskoka District Health Unit and the Province of Ontario for ongoing health updates as the situation continues to evolve quickly.
Great, thank you. Is there any further discussion on this motion? Any comments from the gallery at home? Okay.
No.
I will now call the question, and if I don't get majority support, I will be asking those at home for their vote. But all in favor? That is carried. Thank you to all. Thank you to those at home. Thank you. Thank you for those at home watching and those at home watching on TV as well. And, sorry, we have one, thank you. Always, just like I forgot the last meeting, a bylaw to confirm proceedings. A mover and seconder, moved by Ralph, seconded by Dave. Thank you. That bylaw number 2020. Bylaw to confirm proceedings at Council at its special meeting held on this very day, March 18th, 2020, be enacted. Any discussion? All in favor? Carried. I will now entertain a motion to adjourn. Moved by Mason, seconded by Ralph. All in favor? All in favor? Carried. Thank you. Stay safe. Help one another.